नमामि धन्वन्तरिमादिदेवम् सुरासुरैर्वन्दितपादपद्मम् लोके जरामृत्युनाशम् दातारमीशम् विविधौषधीनां शङ्खं चक्रं जलौकां दधतं मृतघटं चारुतोर्भिश्चतुर्भिः सूक्ष्मस्वच्छादिरुद्यं शुकपरिविलसन् मौलिमम्भोजनेत्रम् कालाम्बोदोज्ज्वलाङ्गं कटितटविलसत् चारुपीताम्बराढ्यं वन्दे धन्वन्तरिन्तं निखिलगदमिव प्रौढदावाग्निनीलम्।
नमस्कार। आयुष दर्पण के इस अंतर्राष्ट्रीय पेपर प्रेजेंटेशन कार्यक्रम में आप सभी का स्वागत है। I would like to invite all the participants who are indirectly watching this session on Facebook as well as in YouTube. We plan paper presentation sessions on the occasion of the Maharishi Charak Jayanti Janmotsava program, and I wish that all our participants who have sent their paper to the registered mail ID on the Ayush Darpan JM Journal's email ID are now presenting their papers. And first, I would like to invite Dr. Rajesh Kumar Verma ji. I am just making him co-host. मैं आपको co-host बनाता हूँ और आप अपना presentation जो है यहाँ डॉक्टर राजेश जी आप अपना प्रेजेंटेशन शेयर कर सकते हैं। मैंने आपको को-होस्ट बना दिया। डॉक्टर राजेश कुमार वर्मा जी, आपको मेरी आवाज आ रही है? डॉक्टर राजेश कुमार वर्मा जी, मुझे लगता है डॉक्टर राजेश जी का नेटवर्क में प्रॉब्लम है। मैं इंतजार करता हूँ। अत्री जी आप अपना प्रेजेंटेशन तैयार रखिएगा। बाकी जो भी हमारे पार्टिसिपेंट्स हैं वो अपना प्रेजेंटेशन तैयार रखें। आपका नेटवर्क अच्छा होना चाहिए प्रेजेंटेशन के लिए। जैसा कि मैं देख पा रहा हूँ कि डॉक्टर राजेश का नेटवर्क अच्छा नहीं है, तो फिलहाल हम आगे चलते हैं। डॉक्टर राजेश जी का वेट कर लेते हैं 2 मिनट, अगर वो आ पाते हैं तो, वरना हम आगे अपना प्रेजेंटेशन आगे स्टार्ट करते हैं। तब तक देखते हैं कि ये प्रेजेंटेशन वो ज्वाइन कर पाते हैं या नहीं। जस्ट वेट करते हैं। लगता है डॉक्टर राजेश वर्मा जी नहीं अपना प्रेजेंटेशन दे पा रहे हैं। तो आकांक्षा जी आपका प्रेजेंटेशन तैयार है? मैडम मैं आपको अनम्यूट करता हूँ।
जी सर, आई एम रेडी।
तो मैं आपको को होस्ट बनाता हूँ, आप अपना प्रेजेंटेशन स्टार्ट कीजिए, बाद में डॉक्टर राजेश करेंगे। जी
ओके सर।
डॉक्टर राजेश जी आप थोड़ा वेट करिए क्योंकि आपका नेटवर्क चला गया था। डॉक्टर आकांक्षा जी प्रेजेंट करेंगे अब। जी डॉक्टर साहब आप प्रेजेंटेशन स्टार्ट करिए। जी आप शेयर कर सकती हैं डॉक्टर साहब।
आई एम विजिबल।
यस योर आप शेयर योर जस्ट आप अपना स्क्रीन शेयर कीजिए।
यस सर, जस्ट
शेयर स्क्रीन का ऑप्शन है, उसमें आपको
Yes,
होस्ट
sir,
बनाया
yes,
हुआ है, आप शेयर स्क्रीन पे
Yes, sir,
क्लिक
sure.
करिए।
Yes, sir. Just a minute. Can I just join from my mobile because it is not showing on Google Drive. Just I will take.
कोई बात नहीं, आप शेयर करने का शेयर करिए, स्क्रीन शेयर हो जाएगा वहां
Sir,
से।
I'm just
का नेटवर्क भी प्रॉब्लम कर रहा है लग रहा है।
just a minute, sir. Just give me 1 minute. I'm just free. Yes.
शेयर नहीं हो पा रहा है आकांक्षा जी?
सर ड्राइव ओपन नहीं हो पा रहा है।
चलिए
इट
आप
इज
समय
ऑथेंटिकेशन मांग रहा है।
नहीं तो आपकी ड्राइव, आप पीपीटी नहीं बनाया आपने?
सर मैंने बनाया ना।
पीपीटी खोलिए ना आप सीधे।
ओके सर।
चलिए तब तक हम प्रभांशु गुप्ता जी को हम लेते हैं। तब तक आकांक्षा जी आप तैयार कर लीजिए। प्रभांशु गुप्ता जी को मैं को होस्ट बनाता हूँ। प्रभांशु गुप्ता जी जिनके पेपर्स तैयार हैं वो हम उनको पहले ले लेते हैं। ये आपको मैंने को होस्ट बना दिया है। प्रभांशु जी आप प्रेजेंट करिए जी।
सर मेरी आवाज आ रही है? हेलो।
बढ़िया आ रही है। आप पीपीटी शेयर कीजिए।
जी सर मैं कर रहा हूँ।
अपना परिचय भी दीजिए, उसके बाद राजेश कुमार जी तैयार रहेंगे।
यस
कुछ
सर।
नहीं करना है, बहुत आसानी से हो जाएगा आपका प्रेजेंटेशन।
यस सर। माई सेल्फ डॉक्टर प्रभांशु गुप्ता, पीजी स्कॉलर, सेकंड ईयर फ्रॉम द डिपार्टमेंट ऑफ
तो
क्रियाशारी।
फुल स्क्रीन डॉक्टर साहब, इसको फुल स्क्रीन करिए, इसको रोटेशन मोड में लाइए ताकि आपका प्रेजेंटेशन सबको दिखे ना। ये
यस सर।
प्रजक्ता जी आप भी करेंगे। आप अपने उसको ना मोबाइल को रोटेट करिए उसको, तो फुल स्क्रीन पे आएगा। मोबाइल को ना उसपे रोटेशन रहता है, उसको ऑन करेंगे तो वो पूरा पूरा पूरे स्क्रीन पे आ जाएगा। हाँ उसको रोटेशन कर दीजिए और ऊपर रोटेशन रहता है, उसमें ऑप्शन रहता है रोटेट योर स्क्रीन। हाँ अब आप ऐसे करेंगे ना, उसको ऐसे रख देंगे, आप मोबाइल को ऐसे रख दीजिए आप उसमें। हाँ ये देखिए अब आ गया।
यस सर।
अब आप अपना प्रेजेंटेशन स्टार्ट करिए जी।
यस सर। माई सेल्फ डॉक्टर।
प्रेजेंटेशन आपका अच्छा दिखना चाहिए जी।
यस सर। सर कैन आई स्टार्ट?
यस यू कैन।
Sir, myself Dr. Pravanshu Gupta, PG Scholar, second year from the Department of Kriya Sharir, Dr. D.Y. Patil College of Ayurveda and Research Center, Pimpri, Pune. Today, I am presenting the topic Management of Musculoskeletal Disorder with special reference to Vatrak by Ayurveda. Introduction. Description of Vatrak. Disease is explained in almost all Ayurvedic Samhitas. The word Vatrakta is made up from the combination of two words, Vat and Rakta. The nomenclature of disease can be done in many ways, since the innumerable diseases can be differentiated on the basis of bisected dosas, manifested as symptoms of involved doshyas, and the causative factor acting cumulatively. So also the disease can be named after any of the above factors. The Vat is the chief, without which no disease can take place. The Rakt is also a very important dhatu which gives nutrition to each and everybody's tissues and maintains them normally by eliminating toxins, malas, through the natural orifices of the body. It is a disorder that occurs due to the association of Vat dosh with Rakta Dhatu. So, for as Vat Rakt is concerned, as the term itself denotes, Vat and Rakt, which are predominant pathological factors acting in the disease processes. However, it can have the following derivations. Causes: excessive consumption of salt and salt or salty foods or sour foods, pungent foods, alkaline foods, moist and dry foods, un- uncutters or oily foods, hot foods, the meat of aquatic animals, meat of animal living in marshy lands, food prepared with a paste of sesame, indigestion, consumption of curd, buttermilk, sugarcane, etc., consumption of virodhihar. Pathogenesis. In Vat Rakt, there is a vitation of Vat and Rakt, where after consumption of the above mentioned causes, Vat get vitiated, which leads to the vitation of Rakta Dhatu and Rasvaha Strotas and Raktavaha Strotas. These are mainly involved in the disease. Vat Rakt usually starts from the big toe or hand and gradually involves other joints or tissues. Acharya Charak explained it in a separate chapter and mentioned two types of Vat Rakt as Uttan and Gambhir. Other than these, four types of Vat Rakt are also mentioned depending upon the predominant of doshas, namely Vat, Pitta, Kapha and Rakta Pradhan Vat Rakt. Different types of Vat Rakt. Vat Pradhan Vat Rakt. Symptoms like pain, twitching, pricking pain, swelling, which is dry and black, stiffness of the body parts, aggravation of symptoms by cold and numbness. Pitta Pradhan Vat Rakt. Severe burning sensation, sweating, fainting, thirst, tenderness, pain, swelling, and suppuration. Kapha Pradhan Vat Rakt. Swelling, severe pain, and pricking pain. The copper color of the skin, itching, and moisture predominate. Rakta Pradhan Vat Rakt. Numbness, heaviness, moistness, untouches, coldness will prevail. Vat Rakt is also of two types based on its location. Uttan Vat Rakt afflicts the superficial tissue like skin and muscles. Symptoms include limited into the skin. Disease, the symptoms moreover look like skin disease or Kushth with skin lesions and muscle pain. Gambhir Vat Rakt, pathology involves blood and other deeper tissues like bone, joints, and internal viscera. This is moreover a systemic illness and the symptoms are more complicated. These moreover looks like a joint pathology because of joint symptoms are more than the skin presentation. Complications. Vat Rakt may produce sleeplessness, anorexia, shortness of breath, heaviness in head, gangrene of muscle, fainting, hiccups, excessive thirst, skin disorder, burning sensation all over the body, tumors. Treatment. The treatment principle of Vat Rakt comprises externally Abhyang, Parishek, Alep, internally purgative, Sneha, Basti, Rakta Vistravan. Shaman Chikitsa. Guduchi is the drug of choice of Vat Rakt. Churna like Nimbadi Churna, Nishod Churna. Decoction. Patoladi Kvat, Amrutadi Kvat. Arishta like Khadir Arishta. Grit and tail like Guduchi Grit, Bala Grit, Jivnia Grit, Pinder Tel, Sukumar Tel are used. Guggul like Keshor Guggul, Punarnava Guggul, Amrita Guggul are given in condition of Vat Rakt. For external application, Tagaradi Pralep, Shaddot Grit and Baladi Lep are effective. Raktamokshan. The special emphasis is given to the Raktamokshan by Acharya Charak. He said if symptoms like pain, tenderness, burning sensation are present, one should use leech therapy, that is Jaloka Ucharan. If symptoms like emptiness, shunyata, paresthesia, chimchimayan or itching are present, then shrink and tumbi can be used. In Avran condition, Kapha med Avran condition, Vyayam, exercise, Shodhan, Arisht, Gomutrapan, Virechan, Takar Prayog and Haritakki is beneficial. In Raktapittadi Vradhi Vat Rakta Bhedan, Shodhan and Ropan are adopted. Classical remedies are Vyadi Grat, Bala Grit, Parusha Grit, Jivnya Grit, Drakshadi Shir, Jivakadi Mahasneha, Baladi Yog, Kashmaryadi Kvat, Madhurmyadi Tel, Sukumar Tel, Mahapadmadi Tel, Kut Padmak Tel, Shatpak Madhuk Tel, Bala Tel, Pind Tel. For reducing burning sensation, grapes, soras, sugarcane juice, kanji, etc. can be used for drinking purpose. For local application, Dahanashak Lep, Tiladi Lep, Prapondarkaradi Lep can be used. Pathya. The role of healthy diet and lifestyle is an important factor in Vat Rakt. Patient of Vat Rakt Punarnavaya, Godhum, Shali, soup of adaki, chanak, mudga, leafy vegetables are useful. Apatya, Diva Swapna, Santap, Katu, Ushna, heavy to digest food and Dadi should be avoided in the Vatrakta. So the conclusion is the prevalence of lifestyle disorders in increasing rapidly and Vatrakta is one among them. Preventing the causative factor of disease is the foremost measure that can be taken. A healthy diet and lifestyle can be followed by adapting the regime and practice mentioned in Ayurvedic classics like Dincharya, Ritucharya, the proper method of eating food, etc. Even then, if Vatrakta arises, one can opt for the above mentioned formulations. This paper of mine is nothing but an amalgamation of various formulations mentioned by Acharya Charak in Charak Sahita, Chikitsa Sthan, chapter 29. This is a literary review. This formulation can be an interesting topic for clinical research that can be done later on. Thank you, sir.
Thank you. If any question from audience part, you can ask with आपके अगर कोई सवाल हो, if you have any question, then you can ask, and then कोई भी आपके सवाल हो, if any question, then you can ask. So I hope that very nicely presented your topic.
Thank you, sir.
Dr. Prabhanshu Gupta ji. Dr. Prabhanshu Gupta ji, now I hope that Dr. Akanksha Srivastav ji, your presentation is ready. Then Prajakta Kaur. आकांक्षा जी अभी तैयार है आपका? तो आपकी ड्राइव अगर खुल गई हो तो आप प्रेजेंट करिए. आपको मैंने कोर्स बनाया हुआ है, शेयर स्क्रीन का ऑप्शन भी है आपके पास. राजेश कुमार वर्मा जी आप प्रेजेंटेशन दीजिए फिर आप तब तक. जी राजेश जी आप दीजिए. राजेश जी आर यू रेडी? यस. इसको आप वो रोटेट कर लीजिए स्क्रीन को, आगे पूरी स्क्रीन में आपका प्रेजेंटेशन दिखे. ऊपर क्या मोबाइल? हाँ यस नाइस. नाउ यू कैन स्टार्ट. राजेश कुमार वर्मा जी पीजी स्कॉलर है, पीएचडी स्कॉलर हैं ये द्रव्यगुण में, और तांतिया यूनिवर्सिटी से हैं. ये पीएचडी कर रहे हैं. ऑब्वियसली आपको इनका प्रेजेंटेशन अच्छा लगेगा. मैंने आपको को होस्ट बना दिया है डॉक्टर साहब. अब आप अपना प्रेजेंटेशन स्टार्ट कर सकते हैं.
जी सर. थैंक यू सर. थैंक यू सर. सर टुडे माय टॉपिक इज आयुर्वेदिक मैनेजमेंट ऑफ यकृत विकार. Myself, Dr. Rajesh Kumar Verma, PhD scholar, Dravigun Department, Tantia University, Sri Ganganagar. So this is the introduction. In India, particularly in rural areas, there is high practicing of folk medicine for diseases like Kamala. In spite of this, prevalence of Yakruta Vikar in Ayurveda hospitals is increasing day by day. In Ayurveda, we get scattered information about Yakruta Vikaras. Common liver disorders. Any abnormalities in shape and features of liver is known as liver issues. The structural anomalies are manifested as hepatitis, cirrhosis, and cyst, tumor, and malignancy, while functional anomalies manifested as damage, down of RBCs, low level of serum albumin, platelet, clotting elements, etc. Liver illness are of many types that may be resulting from a virus, harm from pills or chemicals, obesity, diabetes, or an assault from very own immune system. While the situation is left untreated, it is able to emerge as lifestyle threatening and might completely harm parenchyma of liver and bile duct. Liver disorders in Ayurveda. Ayurveda philosophy taken into consideration Tridosha, Saptadhatu, and Trimala as fundamental aspects of frame, and their balanced and imbalanced country of frame are referred to as health and disease respectively. The three humors are purposeful unit and Saptadhatu are structural unit of frame. The waste made from Ahar and Dhatu are Malas, which calls for right excretion for homeostasis. Liver disorders in Samhitas. Sushrut first time deliver the precise call to the Yakrut Vidrdi as Yakrutolodhyar, wherein as Yakrut Kshaya is narrated in Bhasajya Ratanavali. Yakrut is referred to in Charak Samhita along with the remedy of Plihodara. The pradushti of Yakrut that located in proper aspect of frame as is Yakrutolodhyar referred as in Sushrut Samhita. Yakrut Vikaras comprehensively elaborated in Charak, Susrut, Ashtang Hriday, and Bhav Prakash Samhita, wherein there may be structural and physiological integrity of the liver is affected. Samprapti of Yakrut Kshay, excess intake of Mad because of its Agniya Guna multiplied Pitta and decreased Apadhatu and vitiated Vata to lessen the dimension of liver mass. When Pitta stage is excessive in liver, it evaporates the kapha and harm the structure of liver, which results in consequently degeneration and dryness of liver state. Dry ecosystem in Yakrut contribute a lot for Vata vitiation. Vitiated Vata in additional harm the liver and results in Yakrut Kshaya. Tridosa influence on Yakruta. Generally, Kafaj Prakriti, individuals are greater willing towards extra consumption of fat eating regimen and gradually advance Sthula. Sthula collectively with Sneha Ahara and much less bodily workout ends in growth Abadha Medha, that is blood lipid. Dysfunction of Kayagni produce greater Durmeda and reduce the Medagni. It influences the Dhattvagni and all the three dosas are irritated and get localized in liver. So Yakrut Vikar are Tridoshaj. The Samprapti of Yakrut Vidruddhi. There is a growth of Snigdha Guna and a reduce of Ushna Guna, which causes increase in kapha inside the liver. The deposition of kapha and Durmeda ends in Yakrut Vidruddhi in first example in which all symptoms of kaphas are visible and our Acharya defined as Kaphaj Udar, so referred to as steatosis natural NAFLD, means non-alcoholic fatty liver disease. Further accumulation of Durmeda ends in with the production of Kleda. That Kled alongside with Yakrut Meda produce Sofa in Yakruta and Dhatu Rupantaran and Dhatu Paka. Sroto Dushti in Yakrut Vikara. Further accumulation of Durmeda ends in with the production of Kled. That Kled alongside with Yakrut Meda produce a Sofa in a Yakrut and Dhatu Rupantaran and Dhatu Paka. This situation is relatable to NASH, non-alcoholic steatohepatitis. Yakrut Meda immediately block the Srotas and Srotomool of Yakrut. Consequently, total high blood pressure and cholecystitis takes place. As a end result, there may be blockage of intra and further hepatic ducts, which ends in accumulation of bile and jaundice. Lastly, the treatment in Ayurveda. What is the treatment? Ayurvedic herb establish huge variety of organic supports together with the hepatic production, cholestasis alleviation, liver fibrosis attenuation, NAFLD prevention, hepatic carcinoma inhibition through their anti-inflammatory, antioxidant, and immuno-law mechanism. Liver harm can be minimized by treating underlying regions through anti-inflammatory and immunoregulator herbs, mineral and herbo-mineral formulation. So just in according to our Acharya and mentioned in our classical text, Langanam Paramasadam. Langan is the best remedy for all type of disease. So fasting is the best and supreme medicine. Ayurveda recommended that fasting helps degrade stem cells and help in immunity build. Fasting properly generate the correct and balanced desire to eat that helps overall. Diet plan. Laghu, Shita and Shupachya Tikta Rasa Pradhana Ahar should be mentioned. As liver is the place of Pitta, so Pitta Nashak Ahar is advisable. Gograt organized from curd and leasen Pitta and expanded Agni. Mamsaras can maintain the protein complement in CLD for non-vegetarian sufferers. Intake of water must be confined to 800 to 1200 ml. Takra and Laja Mand can be the weight loss plan of desire to stable the pitta in belly and decrease the acidity. Yoga as a part of recovery. The exercise of yoga gives development of normal fitness and comfortable outlook a lifestyle through making the thoughts non-violent and satisfied with the development in liver function. Pranayam, Kapalabhati, Paschimottasana, Ardha Matsyandrasana, Dhanurasana, Mandukasana are exact for NAFLD and different CLD. Panchakarma, Snehana and Svedana are located beneficial in pruritus and CLD. Nitya Virechan can encourage in cirrhosis affected person with near remark and strict electrolyte evaluation. Woman change into carried out Wilson illness due to the fact woman can correct the metabolic error. These are the important yoga used in Yakrut Vikara, Palatrikadi Kashay. These are the list of yogas mentioned in our PPT. Ayurvedic single herbs used in liver disorders. Haridra, Lashun Kumari, Adrak, Bhumi, Amala, Triphala, Katuki, Bhangraj, Gudchi, and Pranava. These all drugs are already research work has done above the liver. So this is my conclusion. Ayurveda herbs and merchandise have described the bioactive molecules that can defend liver from oxidative stress, virus elimination, block fibrogenesis, and anti-inflammatory, immune modulating, liver regenerating, and inhibiting tumor boom in vitro and vivo studies. Thank you, sir. Thank you, ADF team.
Thank you, Dr. Rajesh Kumar Verma, from is a PhD scholar from Kankia University. If anybody asks, आपका अगर कोई सवाल हो, you can ask with Dr. Rajesh ji regarding the paper presentation by raising your hand. और अगर आपके कोई प्रश्न नहीं है तो हम अगले पार्टिसिपेंट के पास आते हैं. अगले पार्टिसिपेंट हैं, I think Atri Ghosh. Atri Ghosh, you are ready for your presentation?
Yes, sir.
You can present here. Just you share your presentation through share screen.
Yes, sir. My screen is visible.
Yes, it's visible. Yeah.
Hello, everyone. Myself, Dr. Atri Ghosh, second year PG scholar from the Department of Shalakya Tantra. Today, my topic is an Ayurvedic review on the management of squint. Look, we all know the squint is the improper alignment of the visual axis of two eyes. It can be a defect in relevant muscle power or the direction of the motion or the disorder of the brain. It is occurred due to lesion in the cranial nerve 3rd, 4th, and 6th, or due to increased cranial pressure, intracranial pressure. Here it is the types of strabismus. We look, that is the normal eye. There is a esotropia. Next one is exotropia. Next one is hypertropia. Next one is hypotropia. We all know the classification of the squint, so I don't take so much time on that. Next one is importance of the squint in Ayurveda. Here we can see the squint surgery is done for the cosmetic purpose. Many persons who live in the village don't know about the surgery, and ignorance of this disease leads to amblyopia formation. Cardinal feature of the squint is when one of the eyes is deviated from its normal position. Same symptom is mentioned in Ayurveda also. In Ayurveda, such as Jimbha Akshi, Sthira Nayan, Drishti Stambhan, Akshi Jadya can be considered as a squint. Here are the causes of the squint. I highlight the main point, that is Vata. When associated with the Teja Mahabhut, it causes Vikritakshi. Another concept is when Vata is there is a sensation of Rupa is conveyed through the Rupavaha Dhamani and reaches to the Mona and Atma. In this way, Rupa is perceived and interpreted. First, Atma is linked with Mona, then Mona linked with Indriya Buddhi, and Indriya Buddhi linked with Indriya Adhishtan. When Indriya Adhishtan linked with Indriya Rupa, then the only meaning of the Rupa is interpreted. So from this theory, we can see when two eyes are focuses with one object, mind receives the one image. But if there is a deviation in one eye, then two eye focuses with two different objects, and mind also receives two different images simultaneously. At that time, if the normal eye focuses any particular object, Karala Netra is deviated from its normal position. Next one is symptom related with the deviated eyes from its normal position in Ayurveda. in Sthiranayan can be correlated with Agantuj Unmat. It can be correlated with the restrictive squint. Drishti Stambha, which is mentioned in the Apatanak, can be correlated with the restrictive squint. Netra Vikriti, which is mentioned in the Ardit, can be correlated with the paralytic squint. Udavarta has the symptom of Akshijadda, that can be correlated with the incomitant squint. In Graha Rog like Naigames, there is a symptom Urdhva Nirikshana, that can be correlated with the hypertropia. And the Skanda Graha, there is a term Urdhva Nirikshan is used. This symptom can be correlated with the hypertropia also. So the treatment of the squint as per Ayurveda. First, preventive aspect. In third month of the gestation, Indriya is developed. So that month, Shir, Madhu, Sharpi, and Shita Dabha Ahar should be taken. And we all know the Phalashruti of Nasya, that is Indriya Diryata. So we can advise the patient Nasya also. In curative aspect, in the strabismus, we should aim to improve the strengthening of the eye muscle by doing some Ayurvedic therapy like Parishek. Parishek, it helps the strengthen the muscle. Next one is Netra Tarpan. It also helps to strengthen the eye muscle also. Next one is the Sashtik Shali Pindashet. Beneficial, it is beneficial for the neurological disease. Next one is Murdini Tailo. We all know it is it can be done in four ways. It strengthens the nervous system and its coordination with the muscles that control the eye movement. Next one is the Abhyantar Chikitsa. We can give Ekangabir Rash, Mangshavachak Boti, Tapadi Lauho, Ekal Drabha like Nag Bhashmo, Raupo Bhashmo, Shadna Akshik, Vala Ashwagandha. Both are helps to increase the muscle tone and rejuvenate the nerves. And these are also chakshusha in nature. So we previously see that there is a Agantaju Unmat has a symptom like squint. So in Unmat Chikitsa, we can give Medhyarasan just like Yashti Madhu, Churna and Shir. We all know that Yashti Madhu Churna is chakshusha in nature also. We can give Nashya therapy also, as it removes the morbid dosha from Netra, Kantha, Karna. We can give Anjan also, as Netra Ivo Sthite dose, we can use Anjan. We can use Panchakarma therapy as it causes Hrid, Indriya, Shira, Pashta, Shuddhi. Next one is Udavarta. In Udavarta, we can give Abhyanga with Abhyanga, which is prescribed for Sita Jar. Thereafter, we can do Shedan therapy. Then we can use Varti, and we can also use Nirho Varti and Anjas type of purgative therapy also. In Noigames, in Graha Chikitsa, we can make decoction of the Dashamul mixed with milk, Madhur Gana. In Skandagraha treatment, we can prepare a ghee with Devdaru, Rashna, Madhu and milk that should be given to the patient. Next one is Ardit. Ardit and Navanang Nasha, Murti Taile Tarpanang Ebacha. So we can give Navan Nasha, Murti Taile, Upanaho, Tarpan and Narishet. So the discussion is, we can now understand that in Vakradishti, Vata is a main dose. Identification of any object in correct size, position is the main function of the Alachak Pitta. So here, Pitta is also vitiated. In other words, Vata vitiated Pitta. Here Vata is mainly Pranavayu, as the seat of the Pranavayu is head, and Pitta is Alachak Pitta. So we should give Vata Saman treatment here, and mainly Vata Saman treatment which is specifically used for the Siror Pradesh like Vringhan Nasya, Siravasti, we can also given to the patient. Next one is a conclusion. So many person live in the village does not know about the surgery. There are many complicated cases which cannot be corrected by surgery. Though there are different free surgical camps arranged for squint, but apart from that free medical camp, the cost of the surgery is very high. Ignorance of this disease leads to amblyopia formation. So early treatment is needed. So the main aim of the Ayurvedic therapy is slow down the process and give strength to the eye muscle by giving Vatahara and Vringhan Chikitsa. That is my reference. Thank you.
Thank you, Atri ji, for a nice presentation. If any question from the audience, अगर आपके कोई सवाल हो तो you can ask. And राजेश कुमार वर्मा जी, आपका कुछ क्या है, कुछ पूछना है आपने?
हाँ जी सर,
बोलिए
सर अत्री सर से ये पूछना है कि ये जो स्क्विंट होती है, ये एनाटॉमिकल डिफॉर्मिटीज होती है या फंक्शनल डिफॉर्मिटी होती है?
जी अत्री जी, आप जवाब देना चाहेंगे?
फर्स्ट एनाटॉमिकल डिफॉर्मिटी होता है, उसके बाद वो करेक्ट नहीं होता है तो धीरे धीरे वो फिजियोलॉजिकल डिफॉर्मिटी होता है। जैसे मैंने बोला एम्ब्लोपिया फॉर्मेशन। एम्ब्लोपिया फॉर्मेशन क्या होता है? हमारे कोई भी आंख एक ऑब्जेक्ट को देखते हैं, मतलब कोई भी ऑब्जेक्ट को देखते हैं तो फोबिया में उसका पिक्चर क्रिएट होता है। अभी कोई आंख डेविएटेड है तो जिस आंख नॉर्मल है वो उसका इमेज एक फोबिया में गिर रहा है, बट जो आंख डेविएटेड है उसका इमेज फोबिया में नहीं गिर रहा है, वो फोबिया के साइड में गिर रहा है। इसको बोलते हैं एक्स्ट्रा फोबियल।
ओके ओके।
तो एक ब्रेन में दो इमेज क्रिएट हो रहा है, इसलिए धीरे धीरे जो आंख डेविएटेड है वो बिकम्स एम्ब्लोपिया, उस आंख का विजन धीरे धीरे कम हो जाएगा।
ठीक ठीक। सर एक छोटा सा और क्वेश्चन है।
हाँ सर बोल।
मैं ये पूछ रहा हूँ कि जैसे आपने बोला ना पंचकर्म के लिए नशे वगैरह, चलो ठीक है, ये तो नासा के द्वारा देंगे तो वो आई पे एक्शन होगा, बट आपने बोला कि जैसे उद्वर्तन वगैरह हम करेंगे तो उद्वर्तन तो जो है जैसे उद्वर्तनम कफरम मेद सब प्रबलायनम ये सब है।
उद्वर्तन नहीं, उद्वर्त में मैंने बोला था, उद्वर्त का एक सिम्टम ही है।
अच्छा, उदावर्त उदावर्त।
हाँ।
ओके ओके ओके, ठीक है ओके सर, थैंक यू।
प्रोनाउंसिएशन की शायद कुछ रही होगी, पर बहुत अच्छा प्रेजेंटेशन आपका। आकांक्षा जी, एक सवाल शायद पवन शर्मा जी का है, शायद उनका भी ले लेते हैं, फिर आपका। आप अपना शेयर रखिए स्क्रीन जी। बोलिए पवन जी। बोलिए पवन कुमार जी, कोई सवाल है आपका?
जी सर गुड इवनिंग सर। हाँ सर, मेरा सबसे क्वेश्चन है, बच्चों में इस व्याधि को आप कैसे देखते हैं? उसमें कौन सा सर ने बोला वात की वजह से होता है, और इसमें एक तो वात में कौन सा गुण इसमें ज्यादा प्रोमिनेंट होता है, किस गुण को हमें ध्यान में रख के चिकित्सा करनी है बच्चों में? और सेकंड क्वेश्चन मेरा सर से है, सर ने इसमें मैनेजमेंट में षष्ठी शालिक पिंड स्वेद बोला है, षष्ठी शालिक पिंड स्वेद हम किस पोर्शन पे करेंगे उससे?
चलिए पवन जी के सवाल का उत्तर अत्री जी आप देना चाहेंगे?
सर एक बार फिर से रिपीट करिए फर्स्ट क्वेश्चन मुझे।
वो पूछ रहे हैं कि षष्टिक शालिक श्वेत का प्रयोग आप कौन सी पार्ट में देंगे इसके?
और जैसे फर्स्ट क्वेश्चन ये है सर, बच्चों में आप इस व्याधि को किस रूप में देखते हैं? और इसमें आपने बताया वात प्रोमिनेंट डिजीज है, तो वात का कौन सा गुण इसमें बढ़ता है और कौन से गुण की इसमें चिकित्सा हम करेंगे, कौन सा द्रव्य यूज करेंगे?
चलिए जी बताइए यात्री।
फर्स्ट क्या है, ये हम लोग बोला, मतलब फर्स्ट हम लोगों को पूछना है, मतलब जैसे मैंने बोला प्रिवेंटिव एस्पेक्ट में भी है, तो फर्स्ट मुझे पूछना है कोई ऐसे डिलीवरी के टाइम कुछ प्रॉब्लम हुआ था क्या, मतलब फोर्सेप डिलीवरी हुआ था, नॉर्मल डिलीवरी हुआ था क्या, वो पूछना है एक बार। और मातृ आहार विहार कैसे है, बिकॉज 3rd मंथ में जैसे है उस टाइम क्या होता है इंडिया वगैरह क्रिएट होता है, तो उस टाइम मातृ आहार विहार, माँ का जो आहार विहार है वो ठीक कर रहा है क्या, वो भी पूछना था। और दूसरा इसमें वायु का चलगुण बढ़ गया, तो इसलिए हम लोगों को स्थिर गुण वाला कुछ द्रव्य देना है, मतलब पार्थिव गुण वाला द्रव्य देना है। इसलिए षष्टिक शालिक पिंड से जो आई मसल को भी स्ट्रेंथनिंग देते हैं, प्लस वो नर्व एंड टॉनिक भी होता है, तो नर्व को भी हेल्प करते हैं। एक्चुअली वी ऑल नो दैट द स्क्विंट इज स्क्विंट में क्या होता है, स्क्विंट 3rd कैनियलर पॉलिसी भी हो सकता है, 4th कैनियलर और 6th कैनियलर पॉलिसी भी हो सकता है। तो नर्व इन्वॉल्वमेंट इज मेन। एक मेमोनिक भी होता है सुपीरियर रेक्टस 4 नर्व के लिए, LR6 लेटरल रेक्टस 6, और बाकी जो भी मसल है वो सब 3rd कैनियल नर्व की वजह से होता है। तो नर्व एंड टॉनिक को हम लोगों को देना ही चाहिए, इसलिए षष्टिक शालिक पिंड से जो होता है वो नर्व एंड टॉनिक भी होता है। तो ऐसे हम लोग काम कर सकते हैं।
हेलो,
ठीक है, चलिए मैं बात करता हूँ। हाँ आकांक्षा जी, आप अपना प्रेजेंटेशन स्टार्ट करिए।
जी सर। नमस्कार सर। मैं श्लोक से शुरुआत करूंगी। रागादि रोगान शततानुशक्तान अशेषकाय प्रस्तुतान शेषान औत्सुक्य मोह रतितान शतानत योपूर्व वैद्य नमोस्तु तस्मै। As we are celebrating the Charak Jayanti, and this presentation is also regarding this, so I am presenting my case of Rakta Pradar, that is Astrid Menorrhagia, which is also known as. So starting from this, it's a very famous saying that if you check the health of women, you check the health of society. So now coming on this famous saying shows a mirror to say the importance of women's health in today's era. So Rakt Pradar is a major issue today in women's problem. Now coming on abstract, Rakt Pradar, the term we used in Ayurveda, is one of the gynecological problem which is associated with heavy bleeding. It can be associated with prolonged menstruation or without menstruation. Rakt Pradar is one among the Rakta Pradosh Vikara categorized by Raja Ati Pravritti, that is excessive vaginal bleeding. It can be correlated with menorrhagia. Ayurveda had many formulations in Samhitas for this treatment. So this is a case study of 24-year female with history of on and off Rakta Pradar from 2 years and role of Vasagrut in it. Now, introduction, coming on introduction part. Due to improper dinacharya, ritucharya, and not following the Rajaswala Paricharya, Vat Pitta Prakopak Ahar Vihar, uterine bleeding, vaginal bleeding, that is Rakt Pradar in Ayurveda, is becoming a major issue of women's health problems during their reproductive period of life. So, and also the surgery is being very popular. So everyone has high hopes to Ayurveda to deal this Rakt Pradar by various formulations, which is given in various Samhitas. So in this case study, I have used Vasagrut and its reference is from Ashtang Hriday Rakta Pitta Chikitsa Adhikar. Vasa being one of the best drug of Rakta Pitta, it will help to control Rakt Pradar as it is described in Tikta Skan and also Ashtang Hriday Durvadi Gana. It is also Tikta and Kashayan Rasa and Katu Vipak and Sheetvir, which helps in which help in the management of Rakta Pradar. Now, if we compare the Rakt Pradar in modern medicine, so according to modern medicine, Rakt Pradar can be correlated with menorrhagia. In modern medicine, it is defined as menstruation at regular cycle intervals, but with excessive flow or duration. It is generally caused by conditions affecting the uterus or its vascularity, rather than any disturbance of function of the hypothalamus pituitary ovarian axis. And this is commonly seen problem nowadays. My aims and objective for this study is to study the action of Vasagrut in Rakt Pradar, to carry out a comprehensive literary study of Rakt Pradar. Coming on to Ayurveda point of view, now where Rakt Pradar is described and what is its nirukti. So it is said that Pradiryate iti vistarito bhavati iti pradaraha. And the other nirukti is asrugriyate yasmin iti asrugdara ittesha api nirukti atra bodhavya. So this nirukti is I have described this nirukti from Charak Chikitsanti's 209 shlok of Chakrapani Tika. Rakt Pradar or Asrugdar, the word is made up of Asrug, that is Rakt or Raja. Dara means it's continuous or excess flow. So Asrugdar, it is known as it's a continuous and excessive flow of Raja or Rakta Pravritti. Its reference of Asrugdara, we can see it in Shushrut-Shari Sthan, Adhyaya 2, Shlok number 2. And Shushrut-Shari Sthan, the chapter name is Shukra Shoni Shuddhi Sharir Adhyay. And also the Pradar is described in Charak Sanhita, Sutra Sthan, chapter number 28 and Shlok number 14. According to Acharya Charak, due to Pradirana, that is excessive bleeding of Raja, it is called as Pradara. Now coming on the main part, that is Nidana, that is etiology and the Hetu, which is being a very important part in the Ayurvedic treatment. Without it, we cannot complete our treatment. So the Nidana, that is the etiology, which is described in Charak Chikitsa San Yoni Vyapat Chikitsa Adhyatis, Shlok number 205. It is written that Yo Atyartham Sevite Nari Lavan Amla Guruni Cha Katunya Ath Vidahini Snigdhani Pishitani Cha Gramyodakani Medyani, Krusharam Payasam Dadhi, Chuktamastu Suradini, Bhajantya Kupito Anilha. So, the all acharyas has shown the various nidana for Rakta Pradar. In Charak Samhita, the main hetu is excessive intake of lavan, excessive intake of amla and katu, vidahi, guru, snigdha ahar sevan, which is causing the Rakta Pradar. In Ashtang Hriday, we see Pittavrit Apan Vayu is the main cause. In Shushrut Samhita, they also considered Pittavrit Apan Vayu as the main cause of the Rakta Pradar. In Kashyap Samhita, Pittavrit Apan Vayu and Ati Vritti of Rakta, they are considered as a Hetu of Rakta Pradar. Madhav Nidan, Yog Ratnakar and Bharat Prakash, according to these acharyas, Viruddha Bhojan, Ati Maithun, Abhighat and Diva Swap Shoks are the various reasons and Hetu for the Rakt Pradar. Now, very important point. Now, coming on the Samanya Lakshan, which is described very beautifully in Shushrut Shari Sthan Adhyaya 2, that is Shukra Shonit Shuddhi Adhyay. It is said that तदेव अति प्रसंगेन प्रवृत्त अनृतावपि अश्रुग्धरं विजानीयात् ततो अन्य अद्रक्त लक्षणात् अश्रुग्धरो भवेत् सर्वः स अंगमर्द सवेदिनः तस्य अतिवृत्तो दौर्बल्यं भ्रमो मूर्छा तमसृषः दाह प्रलापा पांडुत्वं तंद्रा रोगाश्च वातजः तारुण्यो हितसे विन्यास तमः अल्पो उपद्रव भिषक रक्त पित्त विधानेन यथावत् समुपाचरेत्. So according to Acharya Charak, excessive vaginal bleeding during Raj Pravritti, that is Asrugdar or Raktapradar is there, but the other symptoms which it is described very beautifully in Shushruta Samhita, Charistan is they have described Dorbalyam, the Angamad, Savedana, Dhrama, giddiness, weakness, vertigo, that is Trishna, thirst, Pandu, the Lakshan, which can be related to anemia, Tandra, laziness, Pranab, delirium, Daha, burning sensation. These are the other symptoms which is also seen in the patient when we examine the patient. And the very important part, the last line of this shloka, Rakta Pitta Vidanena Yatha Vida Samupacharet. And so here is the indication of the treatment plan which I have included in my patient. Treatment includes Vasa, as it is indicated in Rakt Pitta, and here in this part, it is also given that Rakt Pitta Vidharena. So during the treatment of Rakt Pitta, if we give the treatment of Rakt Pitta as it is given in the text, we will find a very good results in the patient. Now, coming on the treatment part, which I have decided and which I have selected in this patient is, my patient was a female patient, age 24 years, height was 5 inch, weight was 45 years, and the complaints were Ati Raja Pravritti, excessive flow, persisting from 2 years. Along with pain in the lower abdomen, just before the slide, I have shown that the Samanya Lakshan with Shushruta Samhita has also, other Lakshan was also associated. My patient was also having little bit of some symptoms like he was having Pandu Lakshan, and it is also, she is also having burning in the groin area, delirium sometimes, and laziness she was having. And the treatment which I have decided to give the patient was Vasagrut orally 50 ml twice a day. And in Basti form also I have given Vasagrut 100 ml Matra Basti for 3 consecutive days. Now, the main complaints from by which the patient came to me was female. The patient was 24 years and she was complaining of excessive vaginal bleeding with clots, dysmenorrhea and spotting in between the cycles. From 2 years, she had taken allopathic treatment but got no relief. Other related symptoms which I have told you was also lower abdominal pain, burning in groin region, and also the bleeding was 4 to 5 pad per day, and which was fully soaked. Consistency was watery, and it was also associated with clots. Mild dysmenorrhea was also present to the patients. Now coming on examination of the patient, her physical examination revealed normal vitals. Nadi was Vata Pitta, Netra was pallor, was present. USG was normal, pap smear was normal, and hemoglobin was showing 8 gram, and BTCT was normal. Urine was also normal, but in stool, the patient was complaining of constipation sometimes. Now the results and management which I have decided to give this patient was that patient was given Aam Pachanvati for 5 days. That Aam Pachanvati was including Bilva, Musta, Chandan, Dhanyak and Ushi. So this was given 5 days, and after that Vasagrut was given orally 50 ml BD dose, and for 7 days it was given with honey, and also Matra Basti was given 100 ml for 3 consecutive days. Now, after giving this treatment, for the patient was on Vasagrut 50 ml BD for a month, and a result, patient got relief in bleeding in 2 days, and bleeding was normal in next cycles also. The reference which I have taken of Vasagrut is given in Ashtang Hriday Raktapitta Adhyay, that is Chikitsa Stan Adhyay 2 and Shlok number 42. Coming on conclusion part, Rakt Pitta being a major cause in female health problems should be taken more concerns as seen in reproductive life also. Patients near to menopausal age group should also be considered, as it can be major issue for patients going through surgeries of hysterectomy. Ayurveda can play a major role in this area, as there are many formulations in various samhitas which can be used. Yonigata Raktastrav is being considered as Adhog Rakpit, so here Vasagrut was given. Now conclusion on this was my main motto to use Vasagrut was, as it I have also given on slide, that Rakta Pitta Vidhanena Yathavid Samupacharet. So this was the indication which was given in the Samhitas of Shishir Samhita, and it indicates that if we treat Adhog Raktpitra as a if we treat the Raktpitra as Adhog Raktpit, then definitely if we use the treatment regimen which is explained according to Raktapitta, and we use Vasa, which is one of the main ingredients we use in Raktapitta Adhyaya. So by using this, we can get very good results in the patients. So Raktapitta treatment, which I have discussed. The last conclusion point, I will say that we can use many such formulation. Ayurveda being a science which is very a big oceans of a science, we can use various type of medicines, various type of formulation in from various samhitas, and treat the various alignments which is being spreading in this world, and which are being a very serious issues. And the last, thank you, sir, for giving me this chance to participate in this. Thank you so much.
Very nice, very nicely presented, Dr. Akanksha ji. Very good. And so, two presentations are very beautiful presentations, and I hope that all the audience has already enjoyed. Somebody asking in Facebook that why these presentations are not in Hindi. Actually, हमने इस presentations को जर्नल के लिए publication के लिए मंगाया है, इसलिए अंग्रेजी में ही है presentation. आप अंग्रेजी में इसको enjoy कीजिए. अब next presentation जो है वो I think यहाँ पे हमारे साथ में बहुत ही अच्छा presentation था. आकांक्षा जी की तारीफ हो रही है आपकी. अब next presentation है वो मेरे हिसाब से अब दबलीना आचार्य जी का है, और कोई और है तो अपना प्रेजेंटेशन के लिए हैंड रेज करिए. मेरे हिसाब से एक और प्रेजेंटेशन था जो शायद आरोग्य, अब किसी का प्रेजेंटेशन और है तो वो अपना हैंड रेज कर सकते हैं. फिलहाल दबलीना आचार्य जी, यू कैन प्रेजेंट योर प्रेजेंटेशन. आई ऑलरेडी जस्ट नाउ यू आर co-host of this session. दबलीना आचार्य जी, are you ready for your presentation, Dr. Dablina? And
yes,
Prajakta Korde, after the Dablina presentation, you will present.
क्या हो गया इसको?
Dablina जी, आपका presentation को आप share करिए, और अगर आपको
स्क्रीन शेयर नहीं हो रहा,
शेयर नहीं हो रहा है,
आपको अभी हो जाएगा सर, अभी हो जाएगा.
करिए, होगा.
ओके
प्रजक्ता जी, इसके बाद आपका presentation होगा.
ये हैंग हो रहा है फोन मेरा.
कोई बात नहीं, आप अपना सिस्टम ठीक कर लीजिए. फिलहाल प्रजक्ता कोरडे जी को प्रेजेंटेशन के लिए मैं बुलाता हूँ. प्रजक्ता जी, आप अपना प्रेजेंटेशन दीजिए. यू स्टार्ट योर प्रेजेंटेशन. जब तक दबलीना जी अपना तैयार रखिए. जी प्रजक्ता जी, you can present now. You just share your presentation. प्रजक्ता जी, आप प्रेजेंटेशन शेयर कीजिए.
यस सर, जस्ट 2 मिनट्स सर.
हाँ ठीक है. दबलीना जी, तब तक आप तैयार रखिए. जी हमारा इस जो प्रेजेंटेशन सेशन का उद्देश्य नए शिक्षक जन्मोत्सव पर ये है ताकि हमारे जो पीएचडी और पीजी स्कॉलर्स हैं उनको प्रेजेंटेशंस करने का मौका मिले, एक प्लेटफॉर्म मिले जो उनके काम को भी हाईलाइट करे, और जो बेहतरीन प्रेजेंटेशंस हैं उनको हम अपने जर्नल में भी पब्लिश करेंगे. वो 3 प्रेजेंटेशंस जर्नल में पब्लिश होंगे, और सभी को पार्टिसिपेशन, जिन्होंने भी यहाँ पे पार्टिसिपेट किया उन सभी को उनकी रजिस्टर्ड मेल आईडी पे प्रेजेंटेशन का डिजिटल सर्टिफिकेट जरूर जाएगा. और इस प्रकार के कार्यक्रम हम हमेशा आगे भी करते रहेंगे. प्रजक्ता जी, इफ your presentation is ready, then you can share your screen. वैद्य दबलीना आचार्य जी, आप ट्राई करिए. अगर आपका स्क्रीन शेयर होता है तो आप स्टार्ट कर सकते हैं.
ओके सर. सर मेरा स्क्रीन विजिबल है क्या?
हाँ, आपका स्क्रीन दिख रहा है. उसको स्क्वायर में ले आइए, फुल स्क्रीन पे ले आइए.
हाँ सर.
रोटेट कर लीजिए उसको. हाँ, यस, नाउ इट्स ओके.
ओके सर.
लेट इंट्रोड्यूस योरसेल्फ एंड स्टार्ट योर प्रेजेंटेशन.
जी सर.
Good afternoon, everyone. My name is Dr. Debolena Acharji, PG second year, Department of Agattantra, from Dr. D.Y. Patil College of Ayurveda and Research Center, Pimpri, Pune. The topic that I have selected today is Ayurvedic treatment of Sheet Pitta with special reference to urticaria. So, in this paper of mine, I'll be talking about causes, symptoms, and Ayurvedic treatment of Sheet Pitta. My paper is guided by Dr. Deepak Thorat, sir. So, introduction. So Sheet Pitta is one among the Tvak Vikars that is caused mainly due to vitiation of all the three doshas, which manifest in the skin, keeping Rakta as its base, and it is characterized by itchy bumps, raised and dark red skin rashes. Modern medical science describes urticaria as hives that occur due to hypersensitive allergic trigger. Urticaria is a dermatological condition that is characterized by sudden eruptions of itchy wells that may appear in the skin as well as mucous membrane. So there is no satisfactory or specific treatment available for this condition as per modern medicine. In compared to Ayurvedic medicine, there are various procedures that we can perform, and medicaments also mentioned in various Ayurvedic texts. And here in this paper, I will be trying to amalgamate them as much as possible. So aim and objective. So it is a literary study to find out the Ayurvedic formulation and treatment procedures which are mentioned for the treatment of Sheet Pitta. So materials and methods. So it is a review study. Here I've collected information from various books like Charak Samhita, Shushru Samhita, Yog Ratnakar, Vaishajya Ratnavali, Madhav Nidan, Rashi Yog Sagar, etc. And various journals and articles are also referred to. Then talking about the causes of Sheet Pitta. So in excessive intake of Lavan, Katu, Sharshap, Arnal, Shukta, etc. Vihar involving in Vihar such as Sheet Maruta Sparsha, Shita Paniya Sparsha, Chhardi Veg Nigrahan, suppression of the natural urges to vomit, they sleep, etc. This can result into Sheet Pitta. Other than that, external factors such as insect bites or creamy sangharshan, this also plays a very important role. As per modern science, factors such as food allergens, like some people have allergies to cow's milk or soya, eggs, wheat, peanut, fish, etc. Drug reaction like reaction to salicylates, aspirin, NSAIDs, etc. Blood transfusion reaction. Other than that, chronic autoimmune urticaria is caused by anti-FcERI and less frequently by anti-IgE antibodies that leads to mast cell and basophil activation, thereby giving rise to release of histamines and other pro-inflammatory mediators. Symptoms include pain due to Vata vitiation, burning sensation due to Pitta vitiation, itching due to Kapha vitiation. Other than that, there is a specific condition named Varati Dangshanvat Shot. It resembles to that of the sting of a wasp. The skin eruption resembles to that. Other than that, also we can see symptoms like Chardi, Rillash, Jwar, Vidaha, Pipasha, etc. So types, it is basically classified into two types, acute and chronic. So under acute, we can see that spontaneous eruption of wheals which appear, which last for around 24 hours and then vanishes. But recurrent episodes can be seen up to 6 weeks. But in case of chronic, the rashes that will, the wheals that will appear in the body will last for more than 6 weeks. Inducible urticaria is again classified into two types, physical and non-physical. Physical includes heat, solar, cold, etc. And non-physical include contact urticaria and cholinergic urticaria. Next, I'll be talking about the treatment. But before that, I want to mention the Samprapti. So due to the above mentioned causes, Vata and Kapha doshas are aggravated, which in turn mixes up with the Pitta dosh. Further, they spread all over the body and lodge in the external surfaces of the body and produces reddish rashes with intense itching and pricking sensation. Treatment includes starting with Langhan in Alpa dosh avastha, Langhan along with Pachan in Madhya dosh avastha, and Shodhan in Prabhuta dosh avastha. Shaman Chikitsa also holds a very important role. Other than that, Vata Pradhan Tridoshara drugs also plays an important role. For Shodhan, we can opt for Vaman, Virechan as well as Raktamokshan. So the medicines that can be used are hereby mentioned in my slide. Then for Shaman Chikitsa, it can be done in two ways, both Bhajya Shaman as well as Abhyantar Shaman. For Bhajya Shaman, we can opt for Abhyanga Udvartan and Lep. Abhyanga with Katu Tela, Udvartan with Eladi Gana Churna, and Lep. For Lep, we can use Durva along with Nisha, etc. For Abhyantar Shaman, various medicaments are mentioned by, formulations are mentioned by different acharyas. For example, Acharya Charak has mentioned about Udarda Prashaman Mahakashaya, Shushrut has mentioned about Mustadi Gana, and so on. So it is here given in my slide. Then there are certain yogs which are directly mentioned in Shitapitta Prakaran. These yogs along with their Anupan and doses are mentioned here. For example, Shitapitta Bhanjak Rash, Haridra Khanda, Sleshma Pittal Rash, etc. Okay. Next, Samanya yogs which are commonly practiced in management of Shit Pitta. These are commonly used. So, like Laghu Shut Shekhar Rash, Arogavardhani Vati, Gandhak Rasayan, Haridra Khanda, Malla Shindur, Suvarna Bhashma, and Praval Bhashma. Their references along with their doses and Anupan are mentioned here. Lastly, talking about Pathya and Apatya, but before that, single herbs. So, single herbs such as Guruchi, Nimva, Haridra, Ajamoda, Durva, Gambhari, and Amlaki, they are mentioned. And we can also follow Nidan Parivarjan because Nidan Parivarjan helps in preventing a lot of diseases. Pathya includes Jirna Shali, Kulatha, Mudga, Shigru, Dadim, Trifala, Madhu, Ushnodak, etc. Apatha includes dairy products, sugarcane preparation, suppression of urges of vomiting, Matsa, Divasapna, excessive Atap Snan, and Viruddhahar, etc. In the conclusion, all I want to say is that the best treatment modern medicine can provide here is use of antihistamines or corticosteroids, which comes with side effect and withdrawal syndrome. But in Ayurveda, there are a variety of options available. This study is a literary review performed to collect the medicines advisable for this condition. But this requires to be validated by authentic clinical trials. So that can be an interesting topic for research later on. And by that, I want to conclude my presentation. Thank you.
Thank you, Dr. Devlina ji, for your nice presentation. And I hope that next presentation is now ready. Prajakta Korde ji, you can present
Yes,
your
sir.
presentation. This is the last presentation, I think that. इसके बाद कोई presentation बचा नहीं है. जी, Prajakta ji, you can present. Just share your screen.
Sir, slide visible है?
जी, visible है.
Yes, sir. Myself, Dr. Prajakta Kode, scholar second year, Department of Panchakarma. My topic is an Ayurvedic review of Amvata. Introduction. When Ama and Vata simultaneously get ventilated and enters the Trik and Sandhi, finally leading to Sabdata of the body, the condition is known as Amvata. According to Madhukosha, the term Yukpat means simultaneously ventilated of Vata and Kapha doshas, thus implementing these two doshas as a pathogenic factor of the disease. In today's stressful life, life improper food plan as well as the faulty way of lifestyle bring a lot of disturbance in human life, both physical and psychological aspects. This leads to the malfunction of the Agni, resulting in the formation of Ama. Vipatti of Ama. The word Amvat comprises two meaningful terms, Ama and Vata, which from the pathogenic basis of the disease. It signifies the of Ama by Vata to produce Amvat. It is a result of improper digestion in Ama and Vata. The disease is popularly known as Amvata. Etiological factors. Invariably, two factors are responsible for the manifestation of the disease Amvata. As the name indicates, Ama and Vata are those two factors. Nidan. Viruddhahar, Viruddha Cheshta, Mandagni, Nischalta, Vyayam soon after Snigdha Ahar. रूप ऑफ आमवत प्रत्यात्म लक्षण निश्चित दंशवत वेदना सामान्य लक्षण अंगमर्द अरुचि etc. संप्राप्ति of amvata. When the person of sedentary habit with a hypofunctioning digestive mechanism induced in an in complemented diet and regimen, viruddhahar, and or does physical exercise after taking fatty food of the arm is formed and properly by Vyana Vayu reaches the site of Shleshma, where this is Amvat get ventilated by Vata, Pitta and Kapha, then is circulated all over the body through the vessels Dhamni. Then it accumulates in the small channels and joint pores. It renders the patient weak and produce a feeling of heaviness, stiffness in whole body. This substance namely is ama is cause of so many distressing disease when is aggravated and simultaneously affects the pelvic and shoulder girdle and the joint, making the body stiff. This is the condition is known as Amvata. Classification of Amvata according to दोषानुबंध. एक दोषानुबंध, वातानुबंध, पित्तानुबंध और कफानुबंध. अनुबंध of two, वात पित्तानुबंध, पित्त कफानुबंध, कफ वातानुबंध. अनुबंध of all dosha, three doshas Amvata. Classification according to severity. सामान्य आमवात, प्रवृद्ध आमवात. Classification according to chronicity, जीर्ण और नवीन. Management of Amvata. Langhana, Svedan, Katras, Vitan, Hapan, Sendavadi, Anuasan Vasti, as well as Shara Vasti are prescribed for Amvata. In addition of Ruksha Sveda by Valuka Patra and Upnaha without Sneha have been mentioned in Bhav Prakash for the management of Amvata. Effect of the various Ukramas and drugs with the differently gunas are presenting below. Langhan and measure which is brings in lagu in the body, it is known as Langhana. Acharya Vagbhatta is Astanga Hriday has considered Langhan smaller to Aptarpan and described under the heading Shaman and Shodhan. It is the first measure that have been advised for the management of Amvata, which is considered to be Amashatha and also research Vikara. Langan is the first line of treatment in such condition. The pathological originate in the amasha due to poor digestion, presence of mandagni, ultimately resulting in the formation of ama. So starvation will be further stopped to production of ama. In nirama avastha, this is measure may increase the vata dosha. So langana should be stopped immediately after achieving the nirama lakshana. Svedans, the process which is caused perspiration, distress, stiffness and heaviness of all over the body and cold. It is beneficial because it is the Ushna Guna that digests the ama presence. It is the affected area and also delicate the channel. Thus, obstruction of the channels is removed. Relief in obstruction result in perspiration, another type of Svedan which is good in the case of Amvata. In the internal administration of Ushna Jala is Deepan, Pachan, Trutto, Shodhan, Balya, Ruchikara and Svedakara. Pathya Varga. Puranashali, Raktashali, Shastikshali, Pulatha Varga, Shunti, Siddha.
Please mute your mic, please.
Purana Siddhu, Lasuna, Adrak, Shira Varga, etc. Apatya. Dadhi, Matsya, Guda, Shira. Conclusion. Amvat is the formality element capable of producing disability. Ayurvedic taste categorized it is under Kricha Sadhya Vadi and all challenging issue for the contemporary medical science, also owing to changing lifestyle. Its treatment consists of a large range of analgesic, anti-inflammatory and finally surgery, which is not a complete and effective solution with a large number of the side effects. Ama is the chief pathogenical factor of the element of Amvat, which is produced as a result of Mandagni. So the first aim in the management of the disease is suggested to be prevention of the formation of Ama and its pachan by stimulating Jatragni, which is achieved by taking Katu, Tikta and Deepan Pachan Guna promoting drugs. Thank you, sir.
Thank you for your nice presentation, and I hope that all presentations has been finished. So this is a very beautiful session, within 1 hour and 15 minutes, we have taken 5 beautiful presentation, and निश्चित रूप से इनमें से 3 अच्छे presentations को हम जर्नल में भी पब्लिश करेंगे। आप सभी का बहुत बहुत धन्यवाद इस सेशंस में पार्टिसिपेट करने के लिए, और आगे भी इस प्रकार के सेशंस हम चलाते रहेंगे। आप आयुष दर्पण जर्नल पर अपडेट्स देखते रहिए, और आप अपनी पेपर्स जो आपके ऑथेंटिक पेपर हों, आप उस फॉर्मेट पे ayushdarpanjournal.com पर भी आप भेज सकते हैं। आपके पेपर को रिव्यू के बाद जरूर पब्लिश किया जाएगा, और हमारा उद्देश्य इस तरह से नए जो हमारे पीजी स्कॉलर्स हैं, पीएचडी स्कॉलर्स हैं, उनके वर्क को एक प्रकार से आगे लाना है। इसीलिए हम ये बीच बीच में इस प्रकार के हम सेशंस करते हैं। आप सभी को बहुत बहुत धन्यवाद। यहाँ पे आप सभी ने अपना प्रस्तुतिकरण दिया। निश्चित ही रूप से आप सभी को पार्टिसिपेशन सर्टिफिकेट्स आपकी ईमेल पे आ जाएंगे। आपने गूगल फॉर्म भरा है और आपकी ईमेल हमारे पास है। आप अपनी ईमेल पर अपने पार्टिसिपेशन डिजिटल सर्टिफिकेट प्राप्त करेंगे, और आने वाले इशू में आपके ऑथेंटिक जो पेपर हैं जिसको हमारी रिव्यू कमेटी देखेगी, उसको स्वतः वो प्रकाशित करेगी, और उसकी सूचना भी आपको आपकी ईमेल पर चली जाएगी। बहुत बहुत धन्यवाद। आप सभी को नमस्कार, दिन शुभ, प्रणाम, धन्यवाद।
थैंक यू सर।